All right, so moving on to the next type of test you might actually want to do for some infections in pregnancy. This is what is known as a torch panel. The torch panel. So for this torch panel, you just have to do it. You are trying to do various tests. Now, for each letter in the torch, it stands for something. You understand? So the T stands for what? Toxoplasmosis. All right. O stands for other infections. R is Rubella. Okay. C is Cytomegalovirus. You are testing for Cytomegalovirus. Then H is Herpes simplex virus. So you are testing for Herpes simplex virus. So it's just a group of different blood tests. So if you do all these blood tests, you are basically trying to screen or see if the patient have some certain infections. All right. So these are all the infections that basically you are trying to screen for. So these infections can be transmitted from the person to the baby. So that's why you are testing. All right. Now it mustn't be that the person must have all the 5. Okay. The person can just have one among it. The person can have 2. You understand? So you want to check if this pregnant person is able to spread this thing from what? Is able to spread this thing from their self to actually the baby. So you could see it. This is a torch panel. All right, this is how the test kit looks like, right? So they'll test you for each one of them: Toxoplasmosis, Rubella, Cytomegalovirus, Herpes simplex, right? Then the O is any other infection that they want to test you for. So what is done is basically, if a pregnant woman is showing symptoms, okay, of infections, you do this. All right. If a newborn has signs of congenital abnormalities, you do this. If the person has a history of losing pregnancies over and over, you have to do this. All right. So what is tested is usually, they test for what your immune system has mounted against any infection. So for any infection that comes in, your immune system will mount either immunoglobulin M or immunoglobulin G. Those are part of your antibodies. So immunoglobulin M indicates that there's a current infection going on, while if you see immunoglobulin G so much in the body, it shows that the person had an infection but it's kind of like past. So the immune system is just putting out soldiers to keep surveilling for new infections coming up. So if untreated, of course, if any of those infections is untreated, first of all, the baby stands a chance of transmission. All right. Intellectual disability, deafness or blindness, heart defects, seizures. Then the baby is giving birth to, but their weight is low.